Hello again. So now I'm going to talk about the management of eating disorders in people who identify as lesbian, gay, bisexual, transgender and non-binary. We mentioned in the previous section that there are few treatment studies focusing on the experience of men with eating disorders. There are also very few focusing on the experience of people who identify as LGBT. So the question that we asked in this section was, what are the most effective interventions for lesbian, gay, bisexual, transgender or non-binary people who have an eating disorder? And again, like in the males section, we had a qualitative question. What are the needs and preferences of lesbian, gay, bisexual, transgender or non-binary people when receiving treatment for an eating disorder? So a number of studies have highlighted increased rates of eating disorders and also subsyndromal eating disorders in LGBT populations, both in adolescents and in adults. As with males, people may be excluded from typical treatment trials that focus mainly on females with eating disorders. And this leads to the risk that services are unable to offer appropriate treatment to people who do not fit in with our traditional service models. As already noted, there's been very little research on the specific needs of people who are LGBTQ+ and have an eating disorder. So in terms of the evidence that was considered in this key question, there was a meta-synthesis of 9 qualitative studies on the role of gender in treatment experiences. Now, this didn't just focus on LGBT populations, it also focused on gender issues for females. It highlighted the lack of understanding about gender issues amongst healthcare professionals, and this lack of understanding made it more likely that transgender people in particular would disengage from treatment. There was a concern from participants that issues focused on women in treatment, so did not address the needs of men or transgender people. The study highlighted the need for us to address our own unintentional biases and negative assumptions about transgender people. There's a further survey that we looked at that suggested that eating disorders decreased after gender-confirming medical interventions in transgender people as body satisfaction improved. Just going back slightly to the themes from the meta-synthesis, there were 3 main meta-themes identified. The first one being out of sight, out of mind, where people thought that although they believed their gender identity to be relevant in their eating disorder and its treatment, it was not considered or ignored by healthcare professionals. They felt that gender issues were erased or undervalued in treatment, and this was partly because of the clinicians' lack of understanding or unwillingness to talk about these issues. There was also the issue of non-disclosure of gender identity issues to avoid discrimination and stigma. Another theme was health literacy regarding gender issues amongst healthcare professionals. Men in particular, as we looked at in the section on men, are often underdiagnosed, and there was a concern that they have to present with more severe eating disorder symptoms in order to be considered as having an eating disorder. There was also significant distress when gender issues were ignored. The third theme was about creating pathways into treatment that addresses stigma and barriers. So the recommendations for this section are that gender identity and issues relating to gender should be sensitively considered by all health professionals treating people with eating disorders. We think that there needs to be more teaching and training offered to all healthcare professionals to allow them to identify individuals with eating disorders and recognise the potential variations in the profile of symptoms. Services should be designed so that all patients have equity of access to eating disorder services at all levels. And in most outpatient services, delivery of tailor-made, individualised care plans should accommodate considerations of gender or other diversity. And finally, there are a couple of good practice points, really just asking us to try to ensure that our services are inclusive of all populations.